Thank you for joining us for Patient Conversations with Leah, a place where patients and caregivers can talk with me about the real, relevant, and yes, even the raw aspects of their lung cancer journey. Because we want to know and understand these perspectives firsthand from those who are the true experts on what life is like for a young adult diagnosed with lung cancer. Hi, Chasity. I want to thank you today for joining us to share a little bit of your story, your cancer journey with us. And I'd like to start off by just asking you to introduce yourself, maybe tell a little bit about your personal life, and then what your official diagnosis is and when you received that diagnosis.
Okay, well, thanks for having me, Leah. And so my name is Chasity Harney. I'm a mom of three, and I have a daughter who's married, and they're expecting their first child. So I'm getting ready to be a grandmother in October. I have another daughter who is 21, who's in nursing school. And I have a son who's 16, who is a junior in high school. And married to a wonderful husband, Joe, who's always working so I can stay home and kind of focus on my health. But I was diagnosed in 2018 at the age of 40 with non-small cell lung cancer, adenocarcinoma. And that was October the 9th. And from there, kind of was a whirlwind with radiation, chemo, and surgeries, and then my targeted therapy now.
Okay, great. When you think back to the day that you were diagnosed, can you share with us kind of what your feelings were, what you were thinking, and how your family, particularly your husband and your children, reacted to that diagnosis?
Let's see, it was a normal day. I was a school teacher before I was diagnosed for 18 years. I was on year 18. So this year would have been my 24th year. The day before, a couple of days before, I was experiencing a little bit of chest pain, and I've always ran and worked out and really didn't think anything about it, but it didn't go away. So I went to my primary care doctor, and she said, let's just do a CT to make sure you're not having a PE, a pulmonary embolism. And I said, okay. So I went there. That was a Friday. And on Monday, I mean, I never had that pain again. I was back at work teaching, and she got a call. She called me personally from her personal cell phone and said, can you come to my office? And I said, sure, I'll be after work. So I get there and sitting down in her office just with her. And I know she got a box of tissues. I'm like in my head thinking, okay, what's going on? And she just said, there's no really easy way of telling this, but the CT scans look like they really think that you have lung cancer. And my first words, but what about my kids? Because I knew I've always heard lung cancer is one of the most deadliest cancer. And I just kept saying, I've never smoked. And again, this was almost 6 years ago. And I really didn't hear anything that she was saying after that. And she just says, is there anybody I can call? And my brother is a doctor in Bowling Green, Kentucky. He's a surgeon. And I knew he would be able to, like translate and help my husband understand actually what the doctor was talking about, because I couldn't think, after the word lung cancer, I couldn't think at all. So actually she called my brother, and he was really upset with her because he just said, you cannot, she's had no biopsies. Lots of people have nodules in their lungs. And I remember her saying, well, they're so adamant that this is 99% lung cancer that she is scheduled for a bronchoscopy 2 days later. So went in for a bronchoscopy. It was supposed to be maybe less than an hour. They were in there over 2 hours. When the doctor came out, my mom and dad and my husband pretty much knew that he just said he feels that it's contained. That was his words. And they were like, what's contained? He said, I really think it's cancer. Usually it takes 3 to 5 days or whatever they say for biopsies to come back. And the next day I was actually with my son, Cash. He was 10 at the time. And I was in his high school gym that he goes to now, and he was doing basketball training, and phone rang, and it was a number I didn't know. And it was that pulmonologist, Dr. Bhandari. And, I knew by his words. I just said my question to him was, how bad is it? And he said, it's, it's pretty bad. And that's all she wrote. That's where I'm at today. So,
when you sat down and told your kids, kind of what were their reactions and their ages too, since you've been on this journey for a while?
let's see. Bailey was 18. She had just started Bellarmine. She went to Bellarmine for basketball, and so that was October. She was still adjusting, of being away at college. She was 18, and let's see, Maya was 15, and she was, a sophomore in high school, and Cash was 10, and he was fifth grade. My kids have always been strong. They're extremely strong, all three of them. And, they didn't I don't think they understood at first, like the seriousness of lung cancer. They've learned growing up that usually cancer, no matter what, it's a bad deal. So, of course, they cried. The girls did, um, just a little bit. And then Cash, I always tell people, if you see this young man cry, you better go to the hospital now because something's extremely wrong. He's kind of like stoic. He's like his dad, and they really don't show their emotions much. But after we got over the initial, you have stage 4 lung cancer, and my brother saying, do not look on the internet, blah, blah. My girls went into fighting mode. Both of them did. They've always been like that. And Joe, he's always been strong too. But then at night, when we were together and stuff, that's when it would really hit us. And um, Cash, we just try to keep everything as normal as possible, as possible. And when he didn't miss a beat of school, he just kept going on. And, as far as Bailey, she stayed in school. Her coaches immediately contacted me and said, we will make sure she finishes college. That's our goal. And I just told them, no matter how bad it gets, I want her to stay in school because she would be, she would want to come home and help. But, and I had Maya here, but they've always, to circle back around and answer that question, they've always been strong. They've been strong through the whole thing.
That's awesome.
Yeah.
And once you had your diagnosis of non-small cell lung cancer, can you explain to the listeners kind of what happens after that? I know in my situation, I found out that I had, non-small cell lung cancer stage 4 on the on December 18th, but it wasn't until December 30th that I found out my true diagnosis of what my cancer is in terms of the EGFR exon 19 deletion. So if you could just tell the listeners a little bit about what happens after when someone finds out that they have lung cancer, especially those of us that are young and healthy without a smoking history, what happens next, what testing happens next, and what that testing indicates for the patient.
Okay. Well, you were, I think, a year after me. So things were a little different. I was right there at the borderline where, just like, with Stephen Huff, I mean, it was all still new because you were when were you diagnosed?
I was December of 2019.
Yeah. See, I was October of 2018. So right about a year. So at that time, they do the biopsies, all that, but the standard treatment, it was almost like a one size fits all. Always compare it to my classroom. Some teachers teach as one size fits all, and other teachers teach to each individual student and their needs. Well, at that time, the standard treatment at my cancer facility, and it was a cancer hospital, was chemo and radiation. Same chemo, same, the cisplatin, carbo, and then radiation. So I immediately started on both of those in hopes that we would be able to do a biopsy of the mediastinum around Christmas. And if that lymph node that was found there was clear or wasn't showing any activity, I was going to get a lumpectomy. So anyways, I started those treatments, and the chemo was 5 days a week and radiation 5 days a week. I would go to radiation at 7:30 every morning after I dropped cash off, and radiation's quick. So it'd be about 30 minutes. Then I would hit chemo from about 8 to 1 every day, Monday through Friday. And this started roughly maybe 2 weeks. I don't know exact dates, but I was diagnosed October 9th. It was within 2 weeks I had started this treatment. And for some reason I don't really remember what it was, but I started looking up lung cancer things on Facebook, all this, and a man named Stephen Huff appeared. And at the time he was fresh into his journey as well. And he had a article out there or something on Facebook, and it was long, and I read it, and I thought, okay, this mutation could this be something I had? I think he's ALK. Is that correct? Yeah. So I messaged him on Facebook Messenger, and I probably could go back and get those messages, but he said, you need to see, did you get genetic mutation, or I can't remember how he even said it. What's some other words? Genetic mutation, biomarker testing. I can't remember which one he used. I was like, I'm not sure, because nobody had said those words to me, none of the doctors. I said, I had biopsies. And so as soon as I talked to him, I didn't message on my chart. I called and I just asked, did you do biomarker testing? Did you do genetic testing? And they said, yeah, and it hadn't came back yet. And at that time, I was hot and heavy into treatment. Probably a couple of weeks later, I came back, and it was EGFR. And I reached back out to Stephen Huff, and I thought, hey, okay, I'm not okay, I'm doomed, because again, I didn't know about all these. And he said, no, that's another mutation. And, so I start researching, and then that's when we asked for a second opinion. I actually went to a doctor at Christ Hospital who's absolutely phenomenal. And he was another oncologist who specialized in lung cancer. And he just flat out told me and Joe, if this was my wife, she would be going to the James Center at OSU, and she would be seeing Dr. David Carbone. That was about November, I'd say, mid-November. And so we got in touch with Dr. Carbone's office, and we went there and just kind of like touch base. I met him. The problem was I'd already started chemo, right? So I had to finish the chemo and the radiation. I did that there. And he just, at that time, he said, yeah, you have a genetic mutation. I'm not sure we would have done the chemo and radiation first, but we would have definitely done the lobectomy. We have already done the lobectomy. It had been gone. Lymph nodes have been out, blah, blah, blah. Anyways, I stayed back at where I was at. And Christmas Eve, as I had a PET scan after all the radiation, all the chemo was done, in hopes that I'd be able to get the biopsy on the mediastinum, and then in hopes that I'd be a candidate for a lobectomy there. And it was December 26th. The thoracic surgeon came in and said, well, you're no longer a candidate for lobectomy because you have a spot now on your right lobe. She said, actually, it's been there the whole time. We just been watching. We're like, okay, we never heard it, And so her treatment was immunotherapy. And guess what? If you're EGFR and you have a PD-L1, a high expression, the immunotherapy would have killed me.
Right.
And that was December 26th. That next day, I was at the James Center. I called that morning. They said, yeah, come on. It's Tuesday. It's his clinic day. And then that was a Tuesday, Friday. I was on the operating table there. Lobectomy, wedge resection at the same time, and 11 lymph nodes removed. And yeah.
So
then go ahead.
So would you say by speaking to Stephen Huff that was a game changer in your plan?
If I didn't speak, that's what I always say. Yeah. If I didn't speak to Stephen Huff, I would have stayed there not knowing. you know. I mean, I think eventually the next, it started getting more prominent and stuff, and I started meeting other people, and then I think eventually I would have, asked about this and stuff, but that first year, no, I wouldn't
Right.
have.
So, Stephen Huff is pretty well known in the ALK community. He's young and has a family, and he's actually had children since his diagnosis, and all that is like just quite amazing, really. Besides Stephen, what other kind of community or what kind of community have you built with other patients that you have found to be beneficial to your experience, your journey?
Let's see. I think the first one, I got involved in EGFR resistors, and I can't remember how. I think it was Jill, because Dr. Carbone linked me up with her, and also um, Ivy. I just kind of didn't talk to her as much as Jill, and then Lindy Campbell. And then after connecting with Lindy, I connected with you and Elizabeth, and then after that, it's almost like the world, like there was a bomb going off. All these people was getting diagnosed with lung cancer left and right, and they were never smokers, and they were younger, and they were females, and they were like us. So then other people start reaching out as well, and um, we just built it from there. Just
Right.
there's so many of us, it seems like.
So, what would you say is the most beneficial thing about having connections and community with other survivors like yourself, even if their mutation is not the same as yours?
Just being able to maybe throw questions out there, and realize that you're not alone, and feed off each other, and get advice, and just seeing if your doctor is doing what their doctor is doing, or if there's anything new that you need to know about to discuss with your doctor, or maybe to add in your everyday life that will help you.
Yeah, I would agree. I think that for me, when I was diagnosed, I was just shocked. I mean, absolutely shocked. Like you said, like, how is this happening? I've never smoked, and I'm physically fit, and I've always prioritized my health. And to find out that you have something that's stage 4, and they tell you right off the bat is bad and it's terminal. And if you said, it sounds like you had a helper in your brother to say, don't get on Google. But
Yeah.
for many of us, that's where you go. Is you go to the internet, Dr. Google answers the questions, or you start picking apart every person's story. Is this like me? Is this like me? And this is like me. And
Yeah, but I was number 6. I did get on there. It was 6% survival rate for 1 year.
yeah. And
And
see,
then at 5 years, I can't remember, but
I think it's 5% at 5 years, because
it
that's what
was
I read.
6%, and yeah. So
Yeah, just nothing out there. And when Elizabeth reached out to me, and then Lindy, and she connected all of us, I can remember just feeling like I found my people. Like, these are people I can talk to that aren't like, oh, you look great, you're fine. Or, oh, are you in remission? All the classic kind of questions you get, because we don't fit the mold of a typical cancer patient. We're not 65 years old. We're not former smokers. And even if I took out the advice that I've gotten from, people like you and Lindy and Elizabeth, and some of the other, cancer survivors that I met, or cancer patients, just the camaraderie and the just knowing you're not alone, I think is so good for the soul. It's just kind of like your tribe.
but to me, there's a two-way flow to that too, because you can get caught up in so much of it. And I mean, it's every day I get on social media or something that somebody that I've talked to or connected with or whatever, they've passed away. And, I'm on year 6 here, and you're on 5. And, um, so that's one thing that I truly believe in, is to just keep living your life and staying positive. So that's one reason why I kind of step back, is that I want people to see I am living my life. This it's not a struggle to me every day. I have way more good days than I do bad days. And so sometimes I feel like, oh, that can beat you down too if you just constantly are just, reading this stuff. And it's so funny. We have an inside joke at my house that, well, we can't pull the cancer card because mom, if we do that, they'll say there's no way she has cancer. But sometimes, the girls would pull the cancer card. That's what they say, is to get out of a test or something. And they said that's the only time they can do that is if they don't actually see my mom. But if we're at going into a ball game, I'll never forget going to, I don't know, but didn't take water or something. And I'm huge on, whatever water I'm drinking, I have to finish it. I was like not caught up that day, and I was drinking water, and I was like, okay, it's water. And they said, you have to pour that out. And I said, but I have to drink this. I have stage 4 lung cancer, and I have to drink this. And they said, man, pour that out now. And we're just like, okay, whatever. The cancer card didn't work that day, but that's our inside joke.
Yeah, sometimes it works and sometimes it doesn't. And that's one of the questions I actually wanted to ask you is, I know you probably hear this a lot. I do. When somebody finds out that you do have stage 4 lung cancer and they say, oh, but you look great. That can't be true. Oh, that must mean you're in remission. That must mean, oh, you're cured, all these kind of things. What is your response to people like that? Do you just kind of ignore it, or do you try to educate, or how do you handle those situations?
Well, most people I'm around now, they do know, but if I come up on some, I don't, first off, if they could only see my first year of life, my first journey of this, I mean, that would probably make people realize, okay, yeah, I went from long, beautiful hair, my own eyebrows, my own eyelashes, to on Thanksgiving that day, shaving my hair, the struggles of the chemo, the lobectomy, and going through radiation and chemo at the same time, and really honestly thinking I was not going to leave the James Center after that. I think if they, I would try to tell them that I might look like this now, but this journey is not always like this, And I've had people reach out, how do you get to where you're at now? And I just flat out tell them, the first year is hard. The first year is the hardest year. If you can get back past the first year mentally and physically, I think each year is just only going to get better. And I just, just tell them, I take care of myself. I've always took care of myself, and my main goal is to live,
Yeah.
And so whatever I need to do that is what I do.
Yes, I agree. So I think, we have a lot in common. We're similar in age. We were both teachers. We have 3 kids. So, a lot of this diagnosis, like when people say, you're such an inspiration, or I don't know how you do this, or whatnot. I always say, well, the reason I do this is not necessarily for myself. Yes, of course I want to live, but I'm not worried about myself. I do this for my kids. Would you agree with that statement? Or when people ask you,
Absolutely.
what is your why? What do you say?
This is what my why is. My kids. Here's what I always say. No matter what, I'm going to be fine. I'm going to be fine here on earth. I'm going to be fine in heaven. It's the ones I leave behind, knowing that the pain that they're going to be in, if something does happen to me. So that's how I always answer it. And, me, I don't worry about myself anymore. I don't. I just, like I said, I know I'm going to be fine no matter what. It's just what hurts me is just knowing what I will leave behind. Even though I'll be able to see it, whatever, but they're hurt, because we know what it hurts to leave. We know how it hurts to, lose somebody. I don't want them to have to feel that pain.
No, I totally agree. I think that is really the hardest part of, we all know people who lost their parents as children or even young adults.
My husband lost his mom when we were 22 years old, and his brother was 46. And I can still remember, like I just said, he's so stoic. I can remember, and he's a mama's boy. He was the baby. Him being in the shower months after she passed, and him crying. Yeah. And just just like you said, it's just, I want to share. I want to save my kids from going through that.
Yeah, totally agree. That's like, I think the biggest motivator is because the people you love are the ones that are going to hurt the most.
Just you and I will be fine no matter what.
I
So,
agree. I agree. Yes. So because I'm so emotional, I think it's because we left Tristan at college yesterday. You know what that's like, that first real.
WKU, go Tops. Me and Joe both were Tops.
Were you really? Well, I have been so
Mhm.
impressed with
Loved
uh,
it. It's the best.
Western. I think he's
I
going to do
loved it.
great. I'm so
And my
excited.
brother was there. My brother actually he got a 36 on his AT too. Yeah. And I'm
He's
the
one of
teacher
them.
that had to follow up behind that, but oh well. Um, he, he actually got accepted to West Point, every school you can imagine. And he went to his undergrad at Western, and me and him are a year and 11 days apart. So that was just so much fun to experience that with him. Sororities and fraternities. He was a Sigma Chi, and I was Sigma Chi little sister. Some great fraternities there, and I met Joe there. He played basketball there, and that WKU holds a big piece of my heart. It was just a phenomenal place. I think Tristan would be great.
Yes, he's excited. And being where we're from in Louisville, that's not the go-to school. Everybody goes to
Mhm.
UK. So he kind of went on his own and did his own thing and is being his own
Up
person.
here, and that's what, yeah. Well, now where I lived at like an hour, like Western Kentucky. So everybody went to WKU, right?
Right.
But Joe, up here, everybody's UK too, UC, Xavier, all those. But by the grace of God, he got a scholarship there, played basketball there, and we met there. So
Yeah, I think I'm super excited about it. I think that they have a really good setup for the kids there. So I'm
it's a
pretty.
beautiful campus.
It is beautiful. It is beautiful. And I mean, as you know, Bowling Green has grown up so much since I looked
My
at
brother,
Western.
that's where my brother and his family live.
See, now I know somebody that if there's an emergency, I can.
Yeah, and he's actually the chief of surgery at Greenview.
Well, hopefully, don't we have any medical
No, we
emergencies?
don't. Yeah, no. And she's a dentist though. If he needs a dentist, she's a dentist there.
So, Chastity, both of us are on Tagrisso now. Obviously, you have a little bit of different path. I started on Tagrisso, and that's the only quote unquote drug that I've had. I did have radiation to my right lung, but being on Tagrisso, I think, when did you start Tagrisso?
So let's see, I was diagnosed October the 9th, 2018, and I started Tagresso no I think it was November 9th, 2019.
Okay, so we
So
basically
a
started
year,
Tagrisso
yeah, and a
at the
month
same time.
later.
Yeah,
Mhm,
because I was at the end of December.
mhm.
So both of us have been on Tagrisso now for almost 5 years,
5 years,
basically.
yeah.
And um, it is, I consider it a miracle drug. I mean, I take it in the morning at home. There's not terrible side effects, but thinking back to like this Tagrisso thing, um, how is Tagrisso like? Obviously, I think it's probably true for you. They probably seem like mild side effects based on your previous treatments.
Mhm.
But after being on this Tagrisso for almost 5 years, how does your body respond to it? Do you feel like the side effects are getting worse, better? Are you concerned about toxicity? Just what are your kind of thoughts of being about on Tagrisso for this long? Because for people that don't know, this is something we take every day. You don't ever not take it. It's, you don't get a break. It's not like it's a cycle. It's just constant.
Um, I mean, my biggest fear, is uh, first off, the symptoms wax and wane is how I say it. I mean, like today, I feel great. I'm not tired at all, but tomorrow I might just be extremely tired and not be motivated to do anything. It's just the tiredness. To me, I think the tiredness seems to get worse as the longer you're on it, and I've noticed from the blood work and stuff, some things are happening to my blood work that my doctor feels like, it's the prolonged treatment of this taking this drug. As with anybody who would take a drug for so long, their body starts uh like you said, kind of getting some toxicity, uh but compared to chemo and the radiation, the radiation's what's causing me now. I always say radiation is like the gift that keeps on giving, because I had 45 treatments, and I've got this paralyzed vocal cord, all this stuff, but the Tagresso is nothing compared. The side effects and I guess the aftermath is nothing compared to what chemo and radiation is. So it's very tolerable, and if I have to take this the rest of my life, so be it. I will absolutely do it with gladness. And as far as the only thing that really scares me, and I've talked to Lindy about, I think I've talked to you about it, is developing LMD. And I try to kind of stay away from the research about it again, because it's just a lot of the side effects, like things that might be a symptom of LMD. It's like we can experience it all the time with other things. So we just got to have faith and trust that when we do get scans and the MRIs, that they're looking at the meningeals and all that, and just pray that we can stay on this as long as we can.
That's right. I'm a big fan of other modalities of, treatment, or not, I maybe shouldn't say treatment, but adding things to the Tagrisso in terms of not so much like orally with medication, but like, through exercising or grounding or meditating or Reiki or whatever it may be. Do you have anything that you do that it would be considered an additional modality that you feel is helping you stay on Tagrisso longer and stay healthy?
Oh gosh, I walk 5 days a week, at least an hour each time, an hour, and then weight train 3 days a week, and then on Sundays I kind of do full body. But I mean, adding the walking and the weight training was big to me also, and then just some supplements like the magnesium and uh, the EPAs and DH. I have them over here. DHAs, just some different supplements, good probiotic and prebiotic, and uh, protein, adding more just things a lot of people do anyways that want to stay healthy. I just think that you have to really take care of your body and exercise, and just do everything you can to stay healthy.
Okay, great. I want to ask you one last question before we go, and then we'll get things wrapped up. But when you think about lung cancer as a diagnosis, clearly no one wants lung cancer. Can you think of a way that your diagnosis has positively affected your life by chance?
Well, I mean, I always say I wouldn't take it back, because my whole family, we grew in God, but not only that, we live each moment. We live every holiday, every birthday. It's just families first, and I never dreamed I'd be here to. That's one thing I prayed for from day one, is, dear Lord, please let me be able to see my grandbabies and hold my grandbabies. And God continues to bless me, and I feel like there's a purpose for us here now. Is we have to be the light to others who are facing this battle daily, and just remember what that first time felt like when you were told you have stage 4 lung cancer. And just, my takeaway from this is to just be a light to others and let them know it's not over. It's not the end. You can beat this. You can live with this disease. And I'm living to the fullest with it. So
That's great. Well, Chasity, I really, really appreciate you giving us your time today to talk with me. I appreciate our friendship. I think that you're definitely one of the positive things that has come out of my diagnosis, meeting people like you. And I know your time is valuable. And so I really, I just appreciate this. In closing, do you have any questions you want to ask me, a question you have for me at all?
I don't know. I mean, Leah, I feel like we talk so much that I have so many questions to ask you all the time. And Lindy, I mean,
No,
how are you actually doing? Like, how do you feel
I'm good.
mentally and
I'm good. I
physically? Yeah.
think physically, I feel really good. Mentally, I think my biggest struggle is, like you said, the fatigue. And then also just the brain fog. Like sometimes I feel like I'm a
Oh
complete,
yeah, obviously I left out the brain fog.
and the kids will say to me, Mom, you've already asked me this, or you already told me this. And I'm like, sorry. But otherwise I'm doing well. And like you, I try to live my best life one day at a time. None of us are guaranteed tomorrow, and we're all terminal as soon as we're born. Every day you're not going to get any more days. So
Yeah,
try to make the most of it and create memories and value our time together. So I'm doing good. So thank you for
good.
asking. And I just, like I said, thank you so much. I think the listeners are really going to appreciate hearing your story and your perspective.
Thank you for having me.
Anytime.
Mhm.
You know how that is.